Constitutional remedies are the next method of building up the immune system so that it helps to overall build up the immunity so that you do not contract any infectious diseases. This is also a very good method for patients, especially those with chronic diseases, to use constitutional prescribing, where the mental symptoms of the patient, the physical symptoms of the patient, all the disease particular symptoms are taken into consideration, and then a remedy is prescribed which covers the entire totality. It helps in building the overall immunity so that the patient does not contract any disease, any of the epidemic diseases. So it is usually done. Constitutional treatment is said to be effective, especially if you use it in early childhood and even before the epidemic affects the area. If the person's immunity can be developed, he is said to not contract the disease. But it is definitely not a measure for mass prophylaxis. It can only be used in individually building up the immunity of a particular patient. The other concept of prophylaxis is through homeopathic vaccinations. But this is a bit controversial thing because it is not typically based on the homeopathic principles. Dr. Isaac Golden's homeopathic prophylaxis is quite popular, where he has used about 28 remedies in early childhood to prevent the children from various diseases that they may develop in their adulthood. 28 doses of different remedies, mostly nosodes except Lathyrus sativus, has been prescribed in the first 5 years at 2 monthly intervals. 13,000 patients were treated. After treating 13,000 patients with this particular method, 267 patients who were exposed, only 30 patients are said to have developed certain diseases. But there's about 90% protection in the people who have undergone this prophylactic method, which is quite high. It's as good as any vaccination. There was a BCT program conducted against Japanese encephalitis by the Indian System of Medicine and Homeopathy in Andhra Pradesh. This was done in the year 1999, when this particular set of medicines, that is belladonna, calcarea carb and tuberculinum in 2 weekly intervals, was given to the children, given to the patients, and after 2 months a dose of belladonna was again given. This was the program. Out of 2038 cases, 638 deaths had happened before this program had started. In 1999 this program was introduced, and in 2000 they saw that out of 343 cases only 72 deaths happened. In 2001 again, out of 33 cases only 4 deaths happened. This is definitely something to do with the immune system development, and this set of medicines have definitely developed the immune system and helped the children prevented them from getting this condition of Japanese encephalitis. Genus Epidemicus is the most useful method of treating an epidemic or developing, or a very useful method for building up the immunity at the time of an epidemic. In 1996, there was a whooping cough attack in US. At that time, a lot of specific remedies like Drosera and Calibi were used. It did not give much results. The results were a bit poor. Then the genus Epidemicus was found out. Genus Epidemicus is found out using a totality of symptoms of the particular patients who are there at that particular time. Like, for example, there are certain common symptoms for every disease. There are some peculiar symptoms in any epidemic. So collecting the totality of the symptoms, including common symptoms and peculiar symptoms, a remedy is arrived at. That is the genus epidemicus. This is done through a study of all the patients affected at that time during this epidemic. Like that, when they did the study, they found that Corallium rubrum was the remedy which was most indicated in almost all the people affected with this whooping cough. And after giving Corallium rubrum in 14 patients, 12 patients got cured. Whereas earlier with remedies like Drosera, which was kind of a specific, right? It's a generic prescription, a general prescription. And after giving genus epidemicus, 12 patients, that's almost 86% success rate. So that is the use of having this kind of genus epidemicus. If you can identify it, it is not very easy to get into the genus epidemicus. For that, you need to see a lot of patients during that epidemic who have the same disease, and then you take out the common symptoms, you take out the peculiar symptoms, and then you identify which is the genus epidemicus, and then you give. But the greatest problem here is most of the homeopaths don't get exposed to that particular epidemic because of two reasons mainly. One is the patients themselves are not aware that homeopathy can help. Second is the government is also not aware. And so many times the authorities don't give the doctors a chance to interfere and identify the genus epidemicus. And hence genus epidemicus is difficult to find. But in all those states, all those countries where they have worked towards the genus epidemicus, the success rate has been very good. In every epidemic, it gives the best short-term protection. It requires a lot of interaction between the homeopathic doctors, and a lot of patients also need to be seen. Then you get the totality. The main problem during an epidemic is the fear. Most people are seeing the social media messages and all, and they get so anxious and worried. The fear itself kills them. Dr. J.T. Kent clearly speaks in one of his books. Fear is more deadly than the actual disease itself. And we all know what happens when you're scared. So do not be scared of this. Death is not inevitable. The more you fear, the more you are sick. Awareness programs during these epidemics has to be conducted. The nature of the illness, the general preventive measures, and the exact schedule of repetition of the medicine, the people should be aware about. The prophylactic remedies which are being given to the patients may fail because of few reasons. One is if it is a wrong remedy. In that case, we have to redo the totality, once again take the entire symptoms and all, and identify the medicine which is going to help the patient and give the medicine. The second is if there's a change in totality, like the virus undergoes a mutation, or if there is a demographic change, like in a different city, the presentation may be different, then you may have to retake the totality. And the third is if there is a chronic disease in the patient, there is an existing severe condition in the patient, and the patient contracts the epidemic, then the totality is again different. So in that case, we have to restudy the case completely and individually identify the remedy and give it to that particular patient. So this is how preventives are found, and preventives have been useful in the past. So I think as homeopaths, we all have read a lot about this prophylaxis, and we have also seen that it works wonderfully in a lot of epidemics which we come across, like for example at the time when there was dengue, at the time when there was swine flu, at the time when there was leptospirosis, during the time when there is measles, when there is epidemics of mumps. We have given homeopathic medicines, chicken pox. People come to homeopathic doctors because they feel that it gives them good protection. I have many patients who came up saying that, okay, my neighbor told me that it has helped them a lot, and so I also want to take a preventive. So this kind of an experience-based homeopathy is what we are presently able to give to the patient. But as homeopathic doctors, let us work towards collecting proper statistics so that we can actually have a good scientific database saying that, okay, this many patients we have treated. It has to be proper documented treatment records, which will actually give us a scientific backing, saying that this many were treated, this many were cured, and this many did not get cured. Presently, we don't have such kind of strong records, or we are not using these kind of records to present it to the world. So let us work towards it so that we can identify the homeopathic remedies, we can identify our strengths, and we can make the world to identify that homeopathic medicine has a solution in such kind of epidemics. Unless we get to see sufficient number of cases, we cannot exactly come to a conclusion that in this particular locality this is the genus epidemicus. But it has to be seen to it that homeopathic doctors should get a chance to interfere and take down the complete totality of the patients who are affected with a particular epidemic disease during these kind of times. And then when we make a collective study, then we will have an idea about what is the genus epidemicus that is to be given in this particular epidemic. So unless we make an effort towards it, and unless the government sanctions us, permits us to go forward with the study, we will not be able to help the society at large. Anyway, homeopathic medicine is said to be placebo, right? They say, a lot of studies where they claim that homeopathic medicine is just placebo. If it is placebo, how does it work in infants and unconscious patients? Why did they not think about this? How do unconscious patients become conscious after homeopathic remedies? How do infants get better after homeopathic remedies? And I would urge each and every doctor to authenticate this with the help of strong evidence which we can present to the world. I believe we have sufficient literature and sufficient evidence right now itself, but it is not being presented. Presently, each doctor works as an individual, and there are hundreds of organizations, there are hundreds of associations of homeopathic doctors in the country. What we need to do is we need to unite as one organization. But you look at the homeopathic organizations and the associations, so you see that there is one body, some 3-4 associations in Karnataka, or 4-5 associations in Karnataka, 4-5 associations in Maharashtra, 3 or 4 associations in Kerala. Every state has got its own set of associations. I don't say we should not have such kind of association. We should have. But the presidents or the chairperson of each association should be connected with the other chairpersons of the other associations, and there should be a common association for the entire country where each association president or the chairperson will represent that particular association in the All India Homeopathic Association. And then we collect these kind of successful cases, create a forum, create a platform where people can actually see our work. Let us move forward little more rationally, little more scientifically, and I'm sure we can do much better work. We can present our work directly to the world through this. I tell you, in India we have the largest number of homeopathic doctors. If we all unite into one association, our strength is huge, huge. So let us do that. They say Shubh Kam mein deri kyun? So let us start. Let us all identify the association in each state and then put our heads together, form a common association, and then work towards it. Form the strategies to produce the evidence of what we are talking right now.